Gastric bypass surgery. It's the new way for grossly overweight people to be skinny again. They do lose weight, but it's not as easy as it sounds. I'm here to tell you the rest of the story.
I'm embarrassed that I let myself get to this point.
From size 24 to size 4, from 58% body fat to just under 16%. Marty Enriquez started her weight loss plan in the operating room. Doctors reduced the size of her stomach through gastric bypass surgery.
Immediately after your surgery, they call it a pouch, and your pouch is the size of your thumb, and by a year post your surgery, it's supposed to be the size of your fist.
It may sound like a cliche, but the surgery really did save her life. Marty used to weigh 251 pounds. She had diabetes and high blood pressure, not to mention the constant body aches and pains because of her hefty size. Living as a large woman hurt physically and emotionally.
One time I was driving in the car, and I had an old Mercedes then, and these men were driving next to me, and they honked, and they told me to roll down my window, and I looked over, and they said, "Great car, but you're a fat, ugly woman."
And now that she's 122 pounds lighter, the 52-year-old is turning heads. She remembers the first time a man flirted with her in the line at the grocery store.
Well, I lost it. I got out of line and I said, "Oh, I forgot the bread." And there I am like a schoolgirl hiding behind the aisles waiting for this guy to leave because I didn't know how to deal with it.
The journey to the skinny side has had its roadblocks. For months, Marty could only eat the amount of food that would fit inside this small, clear container 2 to 3 times a day. She has now moved on to bigger meals, but not that big. Here's a sample of her daily lunch. She eats 3 meals a day, no snacks. And she can't eat too fast, and she has to chew her food 30 times to puree it. If she doesn't...
We affectionately call it fur balls because you end up throwing up this, a lot of saliva, very thick saliva. And then eventually you throw up the food. And after you do that a few times, it's like, I'm not going to do that again.
The other drawback, her thin frame is now covered with excess skin. Here she is in the operating room again, getting a tummy tuck and thigh lift. We'll take you through that procedure after the break. Wait till you see this video.
Plus, another amazing aspect of Marty's weight loss plan, her employer picked up the tab.
Gun 9 News.
When Marty Enriquez underwent gastric bypass surgery to lose more than 100 pounds, she wasn't quite sure what her body would look like. When fully clothed, her new, thinner body looked terrific. But without clothing, the excess skin was very noticeable. And that's why she went back into the operating room. I want to warn you that we're going to show video of that operation. You may find some of it graphic.
Well, our goal today is to resect all of this additional extra skin here, as we can see by just lifting it up.
Dr. Samimi spent a good 6 hours in the operating room removing pounds of excess skin from Marty Enriquez's stomach and thighs. It's a common surgery for patients who've gone through gastric bypass surgery where the size of their stomach is reduced. Not only do patients have their tummies tucked and thighs lifted, they often end up doing the same to their arms and breasts. Marty had this much excess skin even though she'd been working out every day since surgery. She's been sculpting her body for months. Every morning at 5 o'clock, you'll find her at the hospital's fitness center. She walks 5 miles on the treadmill. This former couch potato is now a fitness fanatic. And her co-workers at University Medical Center have noticed.
I had a physician tell me that I was more credible now because of healthcare professional. How can you be in healthcare and be overweight?
Amazingly, Marty's employer, UMC, paid for gastric bypass surgery. It's not because she's a hospital administrator. The same offer is extended to all employees and their family members who are covered on UMC's health insurance. CEO Greg Pivarato sees it as a good investment.
I had a number of people say, "Greg, don't open that Pandora's box." But as an employer, it's been wonderful. We'll save money. Assuming these people can stay healthy, we will save money in the long run.
Marty is now saving $1,700 a month in prescriptions. Her insurance company saves too. Cheryl Hamilton took advantage of UMC's offer and has lost a whopping 145 pounds. She's gone from a size 26 to a size 10 in about 15 months. Here's a photo of both Cheryl and Marty before surgery. Colleagues come to them for advice on gastric bypass surgery.
I don't mean to scare them, but I ask them if they're ready to die. Because with the high rate of mortality, 1 in 200, you have to be prepared to die. The weekend before my surgery, I spend the whole weekend alone, crying, writing letters to all my loved ones, just in case. Because I wanted to leave my affairs in order. I wanted them to all know if I died that it was an informed decision, that I had been willing to take this risk, and that I didn't want them blaming themselves.
Marty did take a risk and is alive because of it.
It's been a wonderful journey.